Hi, and welcome back to They Say It Takes a Village. Now, before we get into today's episode, I wanted to say a big thank you and give a massive shout out to the incredible team at Wear That Now, particularly my girl, Christelle, for dressing me today. Now, you guys know that this podcast is recorded with video, so I have literally ran out of things to wear, so they came to my rescue. And if you're anything like me and you've got occasions coming up throughout the year and the idea of going to the mall with children gives you anxiety, well, forget about that because Wear That Now has got your back. What they do is after you fill out your style survey on Instagram, they team you up with your own personal stylist who will curate a box specifically to meet any budget, any occasion, and any style. That box then gets sent straight to your doorstep for you to try on the clothes in the comfort of your own home. The outfits that you love, you keep, and the ones that you don't, you simply send back. And it's as easy as that. So do yourself a favor, go and head to their Instagram, which is wear.that.now, fill out their style survey, get the outfits, send me the photos, and happy shopping. My next guest is hailed to be one of the most famous aesthetic and functional gynecologists here in the Middle East, to the point where people travel across the region just to consult with her on aesthetic gynecological surgeries and treatment for vaginismus. Dr. Raya Karakoulaki is the lead aesthetic and functional gynecologist and medical director at the Aesthetics by King's College. And she's here with me to talk about what exactly is aesthetic gynecology, why is there a stigma surrounding it, and potential treatment for women at different stages of life. So without further ado, let's get into it. Dr. Raya.
Good morning.
Good morning. Thank you so much for being here.
I'm so happy to be here. After so long time, we did it.
I know. I feel summer came in between and then your crazy work schedule. And it was so, it took a while. It took a while to get here. But that's what they say. Good things are worth the wait, right?
Oh, thank you so much. Yes, for me too. I'm so happy to be here.
I gave it a very small introduction, obviously, of just, of the greatness that is Dr. Raya. But I wanted to ask you, number one, how long have you been in the UAE?
7 years.
Oh.
I've been here, 7 years, actually and a half.
Okay.
Yeah, yes.
And reasonable amount of time. You're now accustomed to it.
Yes. Actually, UAE, Dubai, it's a very welcoming place. So you feel part of it from the very, very beginning. But yes, it takes some time to realize what exactly is the best thing for you to do here. What's the needs, what is the needs here mostly. Yeah.
And I think that's when I was obviously reading up on your extensive CV and your background, you were basically delivering babies.
Yes. I was a very traditional gynecologist and obstetrician.
And then you did
then I changed for many reasons. But, I found myself limited in some things when it comes to women's health as a traditional gynecologist. So I found be faced with conditions that I was never been taught for that in the university, in my residency, in my training time. And this is where I was, I start thinking I have to do something for that. Maybe they are not the most common conditions, but still are conditions that women are struggling a lot, and there are not many people to help with that, And this is how I got into the functional gynecology, and then the functional gynecology brought the aesthetic as well.
So I guess my question is, what is the difference? What is functional gynecology, and who typically are your patients? Functional gynecology, and also what is aesthetic gynecology?
Yes. So functional and aesthetic, they are two different things.
Okay.
Sometimes aesthetic problems, which have to do with the appearance as well, they might cause also functional problems, practical problems. But basically, they are two different things. Functional gynecology starts actually where traditional gynecology stops. This is how I think about it. And I will tell you, it has to do with the function, how a woman functions. Okay. From, her energy and her mood and, the challenges that she faces in different stages of her life because of hormonal changes that are happening, right? Until practical issues like you have delivered, and then after the delivery you face some challenges with your intimate life, with issues like urinary incontinence, with changes that are happening to the body, or painful conditions as well. And not only after deliveries, in general, during our life, things might change when it comes to our function. And this is where functional gynecology comes in and helps women.
Okay. And then that is as opposed to the aesthetic part, which is...
Okay. Aesthetic, when we're talking about aesthetic cosmetic gynecology, we deal with the appearance of the intimate area. For example, some women, they are born like this, and it's totally normal. There are many anatomical variants. So, which is absolutely normal. But some women, they will find it bothering the fact that, let's say, one small labia is bigger than the other, or that in total the labia is too big, too long, too loose, and that might cause also issues. That might cause issues like, you don't feel comfortable, you feel pain when you wear something very tight, when you go for horse riding, bicycling, and things like that. Or you wear your bikini and you see that there is a lot of volume, underneath the bikini, and you don't feel nice, So if there are issues like that, and the woman is really struggling with these issues, she can correct it. So, and in that case comes the aesthetic surgery, like labiaplasty, for example. Or other examples, let's say you have a massive weight loss, and then the area, our intimate area, has a lot of fat tissue as well, and then you lose the fat there as well as you lose it from other parts of the body. Exactly. And then the skin there becomes very loose, exactly the same like it happens with your abdomen, and you do the abdominoplasty after losing a lot of weight, right?
Yes.
So the same can happen in the intimate area, and then you need a kind of lifting, a kind of correction. If this is something that bothers you, of course, it's nothing that you should do, you have to do, necessarily, if it doesn't bother you and you're okay with that. But if you don't feel okay with this, you have the option, to correct it.
This is it.
Exactly.
I mean, we potentially have options for every aspect of life.
Yes.
And we want those options.
Yes.
So it's good to know that there is something that you can do.
Exactly.
And I don't think that is very much. It's not talked about to have these.
No, it's not. Options. Yeah. It's not talked about because it's a kind of taboo talking about our intimate area, about our intimate life. And that's, to my opinion, it's a shame because it's part of our life, right? As much as, our face is part of our life and how our face looks, if it is glowing, if it is full of wrinkles, if, the color, whatever, the texture. The same is with this part of the body, in case you care for it, and that's the aesthetic. And believe me, there are many women that care for this area, in the same way they care for the rest of their body.
I mean, why wouldn't you? I mean, again, yes, this is something that everything should be looked after, and everything that, your body is the way, I find your body is a representation with how you feel.
Yes.
So if you aren't feeling particularly happy with a certain area, and there are potential options that why not explore them? You don't have to go all out, but of course, to know that they are there.
Yes, yes.
So it's very interesting. But with the aesthetic, but before we get into that, obviously, because you cover a massive, focus when it comes to gynecology. But particularly, I guess for now, I mean, the postpartum and pregnancy, I find that is a very transitional moment in a woman's life, and your body goes through a massive transition. So at what point from what you've seen, gynecological issues, at what point do they rise? Sort of, is it during pregnancy? Is it post-birth? Typically you're seeing patients throughout, sort of, I know that there's obviously sort of teenage, childbearing, and then menopause. That's just to give a rough idea.
And perimenopause and before menopause for many years before.
So this is, there's a range, but I guess I find probably physically pregnancy and birth can take a toll.
Yes, exactly.
What,
because
what are the general issues that you find?
Yeah, I will tell you. So look, during pregnancy, very well, you had 2 pregnancies, there's huge changes, happening in your body. Your hormones are changing. The structure of your body is changing. Everything, relaxes because, and mostly in the pelvis relaxes because it has to grow and it has to fit the baby, right? So, but that, from another point of view, it's a big stress, for your body, for the pelvis. So, because imagine, everything gets stretched and then it has to come back to the normal condition, right? So while it gets stressed, stretched and stressed, and while, you carry all this, weight, there are issues that might happen, like urinary incontinence. That's something that can happen during the pregnancy. Also, you have to run to the toilet.
Urgency.
I remember when I was at the end of the pregnancy, I couldn't drive, for 45 minutes. I would say, no, I can't come because, in the meantime, I needed to go, to the bathroom. So, these changes are happening. And many times these changes will go after a few weeks when you deliver. So these symptoms of urgency or incontinence and so on, because things come back to normal, the anatomy, gets back to not exactly what it was, but close. So, and that might be enough so that you don't have the symptoms and you don't suffer anymore. However, the time that you will see your gynecologist to help you with something will be if, let's say, for some months after delivery, you still have issues with urinary incontinence, or you have painful intercourse, or during the intercourse you feel that it's not the same anymore. You feel loose. You don't have the sensitivity that you used to have. So in that case, you can seek for help. In that case, there are plenty of things that we can do and help. So that's one thing. And the other thing, what I cannot stress enough and I cannot talk enough about is the prevention. So actually, you don't have to reach to the point where you will have to deal with a condition which is uncomfortable. You just be proactive and you do things so that you don't have to do other things later. So, and this is where the post-birth rehabilitation comes, right? So I did my residency in Germany. And I studied in Germany as well. So, in Germany, there is no way that you will not have postnatal rehabilitation with physiotherapy, right? So everyone who delivers has a schedule after the delivery, postpartum rehabilitation with physiotherapy. Also, during the pregnancy, they do a lot of exercise. Public hospitals, they will offer courses for antenatal classes with exercise and so on. So exercise and working on the pelvis during the pregnancy and after the pregnancy is very important. So where functional gynecology with the amazing technology now comes is after the delivery, where it offers a very easy, let's say, and a very effective kind of physiotherapy. But it doesn't work only on the level of the muscles. It works also at the level of the vagina, because the vagina, this is what gets stretched, right? This is where many things are changing, and it might not come back to normal. Or even if it comes to normal, still you can help it to come to the 100% as it was before.
And so just so that I'm, a bit clearer. So when it comes to functional gynecology, is it a matter of, for example, you do a little bit of physio and potentially a surgical procedure, or you can do a combination, or how would it work?
Yes. So physio, it's something that can help. Yes, you can. We can work with pelvic physiotherapists, but we also have some tools, as I said, from technology. Some, I will tell you, we have a chair that works like physiotherapy. It's an amazing technology, and I will explain to you how exactly it works. Then we have machines, devices. We call them energy-based devices like laser, radio frequency. And then we have treatments from regenerative medicine. So we borrow treatments from regenerative medicine like PRP, which is a platelet-rich plasma, like exosomes, like stem cells. So whatever every doctor in his field will use to rejuvenate, to regenerate joints or whatever else. Cardiologists will use it, interventional cardiologists for regeneration. So we use it as well to rejuvenate and bring back to what it was, your vagina.
I got you. And this is, so, I mean, there are treatments, for example, a big one would be, pelvic floor and incontinence. I don't even know if prolapse is a part of, the spectrum as well. These are all under the umbrella of functional gynecology.
Exactly.
And so you potentially have multiple treatments to address whatever is going on.
Exactly. So when, for prevention and to treat treatments, maybe with another protocol, but we will use the same tools. So we will use a tool to strengthen the pelvic floor muscles, and we do that with a chair called Emsella. That's that's electromagnetic field. So it's like the MRI. Imagine you don't get any radiation, but you sit, it's a big chair. You sit on the chair, and the energy that comes out of the electromagnetic field will cause vibration to your muscles.
Wow.
And that causes 11,300 contractions within a half an hour that you're sitting on the chair. And we call them supramaximal contractions because they are very strong. Whatever you can do with the Kegel exercise, it has a limit on the strength, right? You can do that much. You can't do more than that, but the machine can do it for you, right? So you sit on the chair and you get those very, very strong contractions for half an hour.
You feel them?
You feel them. It's not painful.
Okay.
You feel a vibration. This is how it feels, like a vibration.
It's unbelievable.
Yes. You will come and do it.
I'm going to try.
Yes, definitely.
Wow.
So yes. And then what it does is that it makes the muscles, thicker. So you start with a thickness of the muscles in the pelvic floor, let's say that much, right? And then they will become, after the sessions, after you have finished, they will become that much. So it causes hypertrophy, makes bigger muscles. The volume increases the volume of the muscles. And bigger muscles, more strength, isn't it? Right? Yeah. So that's the one way how this chair works. And then the other way is that re-educates also the nerves of the pelvic floor. So they will react better. They will respond better when they need to, so that they will contract. And when you need to go to the toilet, or when you're coughing or sneezing or running, they will know, the nerves will know to contract the muscles so that you don't have to go to the toilet. We don't have to, urinate.
Because that's it. I mean, honestly, the amount of times that you hear when it comes to childbirth, or, jumping on the treadmill or sneezing or something like that, is going to cause a bit of leakage.
Yes.
And that, to be honest, it's not even childbirth. I feel like a lot of the times throughout the course of a woman's life, it's almost accepted.
Yeah. Yes.
That's where it's really, common, but not normal.
Yes.
You shouldn't be, you should be able to hold it. And it's something that I would say would have a quite a detrimental effect to your life. So I had no idea that, you get, yes. And of course there are pelvic floor physios and things like that. But I just find, again, speaking from experience, I had a baby and I tried my best to do what I can.
Yes,
and then you get so busy with life.
Exactly.
And I find, I don't know, again, correct me if I'm wrong, but a lot of the times these symptoms maybe sort of show up down the line. I mean, you could have had a baby 2 years ago. Is it that the symptoms are still persistent, or can they come back?
They can come back, or they can be new, So it can occur at any stage. It doesn't have to be right after the delivery. Why? Because with time, maybe within the next 2 years, you lift too many weights. You don't take care of your pelvic floor, and it becomes weaker.
Absolutely.
So at any stage, it can start.
I've got a question for you. So obviously, a lot of the times, you're focusing on the delivery, and everyone's, wanting to protect the pelvic floor, whether it's a vaginal delivery. But is it the same when it comes to a C-section?
Yes. It's not the same.
Okay.
Definitely. The pelvic floor will not be that much stressed when you have a C-section, but the pregnancy itself, it's a stress, So we have women that face all these issues with just, C-sections. So you don't have to have delivered vaginally in order to have some symptoms. They can happen even without, yes.
And would it be, again, so let's say if I'm a patient that had come to see you, I would have specific symptoms. And then, is it almost like everyone should always go into, what was the chair's name?
Emsella chair.
Emsella chair.
Emsella chair is the first chair that,
Would you recommend that everyone should get a session?
100%.
Really?
100. And this is the postnatal or post-birth rehabilitation.
Wow.
So let's say, ideally, right? You didn't have to pay for that because it comes always down to the cost
of course, and insurance and
exactly. And unfortunately, all these treatments are not covered by the insurance. They're not extremely expensive, to say that, but still, it's not covered. So ideally, let's say if it was covered, I would go and say to everyone, you have to do it. Don't ask. You just have to do it, First to, strengthen the muscles, and second, to do vaginal rejuvenation so that you do something for the skin of the vagina, right? Inside the vagina, because the pelvic floor physiotherapy, the Emsella chair, will not do anything for the quality of the vagina, the skin inside.
Okay.
So we have to work on that level as well. And for two reasons, actually. One reason is for the function of the vagina itself in terms of dryness and lubrication, in terms of sensation, in terms of tightness, to bring it back, because it does become looser. And in terms of prevention, because if you don't do anything in your life, and especially in the premenopausal years, let's say from 40 to 50, you don't do anything, right? You don't take care, as that does not exist, right? Yeah. So you end up around your 50s when you come into the menopause, and you don't have the estrogen, the hormones that they do protect your vagina. You come to that stage, and then more severe symptoms might happen, or conditions like a severe prolapse that will need a surgery, a severe urinary incontinence that will need surgery. You will not be able then to treat it with non-invasive treatments, right? So that's the prevention. But other than the prevention is also the quality of life that you have when you do these treatments, right? Absolutely. First of all, you don't live with, uncomfortable conditions like urinary incontinence.
Prolapse.
Yeah. prolapse.
Yeah.
Prolapse. When the prolapse is very mild, then it can be treated non-invasively with all these treatments that
Even during menopause.
even during menopause,
Okay.
yes, it's not that it's not that easy because you don't respond as strong, let's say, as you respond in your 40s, right? But still, yes, still you can do things. So yes, for for all these reasons, I would say to every woman, yes, after delivery, you do your Emcella chair and you do your laser, radio frequency, PRP, whatever you do for the vaginal rejuvenation. You have to take care, if
100%.
imagine the face, right? We're women. When do you start taking care of your face? Putting nice creams,
washing it properly.
Exactly.
Yeah.
Going to the beauty therapist or starting with Botox, with any kind of
even if you don't do the Botox, you still wash your face and you put cream on your face.
Exactly. Exactly.
At the most basic level.
Exactly. So what you do for this area, for the vagina, inside the vagina, nothing. Right? At the most... Nothing. For inside the vagina, nothing. If you are, a little bit aware and you want to do something, most thing that usually women do is pelvic floor exercises when they do their, training, whatever, in the gym or so.
Literally, I only actually did pelvic floor
which is amazing. Yeah. See?
I didn't even do it prior. I didn't even think to. Okay. No one had a conversation with me about that.
Yes. Also prior, preparing yourself. It's another thing to deliver a baby vaginally when you have a strong pelvic floor, and another thing to deliver when your pelvic floor is weak.
That's true.
Isn't it? The delivery will be better, will be easier. You will push better. You will, the delivery itself will become easier.
I have to be very honest with you, Dr. Mira. No one's ever sat and thought, what's going on with the skin inside my vagina?
See? Yes.
I can almost guarantee it.
Yeah. And this is where I like to call this, treatments V-facial. And
V-facial.
Yes.
It.
Yes.
Yeah.
And there was a huge reaction when I first talked about it. And why on earth should you take care of this area and you should change something, or but other than the cosmetic, which is also very important if a woman finds it important for her, it's also the function.
Yeah.
We do our facial not only to look nice, we do it also to have a healthy skin.
Absolutely.
Right? We don't like pimples. We don't like,
my mind is blown. It's just because growing up, it's sort of self-maintenance, self-cleaning, it kind of does it. So don't really meddle.
Yes.
There's a balance, there's a pH,
True.
There's all sorts of things. Don't do anything.
Yeah. That's true. That's absolutely true. You shouldn't go and wash with soap 2-3 times a day, right? Because you do disturb the balance, and we have good bacteria there that we need. But that's a different story. And by the way, when you do the vaginal rejuvenation with the laser or the radio frequency again, or whatever we use there, we balance the pH as well. So what happens with all this treatment is that they will stimulate the production of new collagen, new elastin, new blood vessels. You have more blood flow, and with blood flow come all the good things, right? So comes the oxygen, the vitamins, whatever you need, and the immune system is better also. With better blood flow, you have better immune system at this area. Many women, and especially here in UAE, I have never seen so many recurrent or chronic vaginitis as I have seen here.
I was just about to ask you, what about recurring infections?
Yes. This is something, don't ask me why it's happening here. I have worked in Germany, in Greece, for a while, in the States. I have never seen in my life so many recurrent and chronic. Something, I don't know what it is. Maybe the warm weather all around the year. I don't know. Something, it's there, but we have a lot of recurrence. So in that case, what happens is we can't explain it. Definitely the local immune system, the immune system of the vagina, for some reason is not that functional as it should be, so that it can fight the infection, right? And that's why you take the medication, it goes away for a while, but then it keeps on coming back.
Yeah.
So, and this is where
and honestly, that again, to have recurrent infections and recurrent antibiotics and honestly, it takes a toll on you and your life.
Yes,
yeah.
Absolutely. Your intimate life, your social life, you want to go, your life with your children, you want to go to the swimming pool, you want to go for, you want to do horse riding, whatever, you can't do, you want to go for bicycling, you can't because you don't feel well there. Absolutely. So this is where, this, treatments are coming, and they help with the immune system, basically. And also better blood flow means also better pH and better, gives life to the good bacteria. Along, of course, with other treatments, topical, that you can do and boost your normal flora. Okay. So, yes, there are many indications,
It's unbelievable.
Yeah. And when we go back to the urinary incontinence, the urinary incontinence, the stress urinary incontinence, this is how we call the incontinence when you will have some urine leakage, when you're sneezing, coughing. So stress means that you're pushing, you put stress on the bladder, and then you will have the leakage. So this kind of incontinence happens because the urethra or the bladder has not the right support. And the support in the pelvic floor happens in the pelvic floor organs, everything. Support of the bladder and the urethra, support of the uterus, the rectum. Those are all the organs that we have in the pelvis. So the support of the organs will happen, one by the basis, which is the pelvic floor, the muscles, and the other is the vagina. The vaginal wall has to be also strong and thick, because the vagina keeps at the right position the bladder up, the rectum down, the uterus up. One of the supporting systems is also the vagina, and it's very, very important. So when you want to treat the urinary incontinence, you treat the basis, the pelvic floor, but you have to treat also the vagina, so that you support the urethra and bring it to the right position, so that you don't have the leakage. So you work on two levels to treat the urinary incontinence.
Would you say these supporting treatments, are they long-term?
No.
Okay.
It's not something that you do once or you do a series
of surgery.
No, it's not like the surgery, but I will tell you the difference. It's something that you have to maintain. Okay, maybe you do multiple sessions at the beginning, the first time, and then for a few years you do maintenance sessions. So
like maybe
a
once
few,
every
exactly,
6 months or something.
Exactly. So not 6 months. Usually it's every year, depending. But they are very easy. Treatments. So you will come, the laser, it's like 3 minutes, 5 minutes.
Wow.
The radio frequency, it's like 8 minutes. The injection, it's like 2 minutes, and not painful at all, also to say that, right? The chair is half an hour, twice a week. But for a few sessions. So yes, you have to maintain. Now, the surgery. The surgery comes in which cases? It comes when we're talking about tightness. It comes when really you have a vaginal laxity, which is very, very big. And, if you want to be honest with your patients, you have to say, these treatments and non-invasive will never bring the result that you want. Because if the woman says, I want my vagina to be as tight as it was before the delivery.
That's right.
Yeah. Then, and you have a very lax vagina, you can't do it with laser. So in that case, you will do vaginal tightening surgically. That's one reason why you will do the surgery. The second reason is if you have a severe urinary incontinence. So I work along with a very good urogynecologist, Dr. Amit. And if I see that I have a severe urinary incontinence, I will send the patient to him. He will do the proper examination what he has to do. And then we do together the surgery. He will put the sling and I do the reconstruction.
Gotcha.
Okay.
Yeah.
So we work as a team for that. If there is a need for that, we will do it.
Yeah.
And if you have also a very severe prolapse, if the prolapse is too much, is too big, then that cannot be treated only non-invasively. However, the trick here is that whatever you do with the surgery, you just change the anatomy. Okay, so you just make the vagina tighter. You make it smaller. That's it. You just fix the position, let's say, of the urethra, of the bladder, and you treat the urinary incontinence. Okay. Or you correct the prolapse. Okay, that's good. What happens with the sensitivity? What happens with the muscles? You don't work on the muscles when you don't make the muscles stronger, right? You don't get more collagen, more elastin, more blood flow when you do the surgery. So that's why for all women that do this kind of surgeries, I tell them, look, now the non-invasive, it's not the treatment, but you will have the surgery because we have to do it. But afterwards, you have to do everything else so that you feel better. Plus, you maintain the good result of the surgery, right? Not after 10 years, you will have to do the same again. Because if you don't do anything, again, the vagina will become loose, again the prolapse will happen. Again, the urinary incontinence might happen. Not necessarily, not in all cases, but it's very likely.
Yeah. You can't just leave it.
No, you can't. You can't.
It's so interesting because again, I think we're only taught anatomy.
Yeah.
In school.
Yes.
Biology. No one, I mean, even, you say vagina. I think now there's so many aspects of that. It doesn't mean just one thing. And that in itself, people are confused about.
Yeah.
So now let's say, for example, moving on to aesthetic gynecology. Typically, I mean, so for example, women post childbirth or women in general, what are they looking for from an aesthetic point of view?
Yes, I will tell you. They, you can divide the women in different stages in their life.
Yeah.
Okay. So the woman between 20 and 30, she will come and she will want to correct the appearance.
Yeah.
Yes. Because she might now start her sexual life and she want to feel comfortable. She want to feel confident. How many girls will come and they say, I don't want to switch on lights when I'm intimate. I don't want anyone to see the area, and I mean, how can you be free? How can you fully enjoy your intimacy when you're thinking, I don't want him to see me. Yes.
Yeah.
So, or they will come with problems like I wear very tight things, or when I have my bikini on, I don't feel comfortable. I'm very conscious about the positions, all these things. So. For women in that age, that's very important. For women after delivery, the changes that might happen after delivery are very disturbing.
Of course.
They say, I don't like my body anymore, how it looks now. Look, I have this scar after whatever, tears, episiotomy or whatever, or the opening is too big or whatever, the labia has become too loose, or the big labia, they become also loose. They might become, not always, of course. So, there are changes that are happening and they are, although they have a very healthy sexual life, right? So it doesn't mean that they have an issue with their partners. Usually, actually, partners are absolutely fine. They do it for themselves. And this is what I really love, right? They are very normal women. And
they just aren't comfortable.
Exactly. Yeah, with the changes. So they want to enhance that, and that's absolutely fine. And then you have women in their 50s, let's say, sometimes even more than 50s. And that's so amazing. Where they face the changes of the aging, of the menopause, or, of the multiple births or whatever deliveries they had, So, and it has changed like everything else. And they say, you know what? I don't like it. I want to change it. I don't like this thing hanging there, or, I don't like it. Or I don't like the color, for example. Or I don't like the wrinkles that are there. Or I don't like the fact that there is no volume anymore and I want to put some volume. Whatever. There are many things that you can do.
That's amazing.
Yeah.
Yeah.
And they do it and they feel so confident. I have women in their 60s and they say, you know what? I don't have sexual life with my husband for many years and I want to change it, and I want to do things for that. So we will start rejuvenating the vagina, or we might do other things if they have special pain conditions, so that we work on that, so that functional, they are okay, no dryness, no atrophy, no pain. And then she says, I want to feel beautiful there, and they will do also maybe other aesthetic procedures. And they start a new life with their partner.
Honestly, if that is not empowerment, I don't know what is.
Yes.
This is the thing. I mean, again, you'll always get two sides of the coin. Like, why would you? This is, something that, this is, again, something that there is a stigma associated, that it's not a necessary, it's a luxury. It's not something that needs to be done. But also at the same time, you've got other people on the other side. You want to have that confidence. You want to feel good. You want to, whether that's reignite something with your husband, whether that feels good for you, whether you just generally are happier within your own body.
Absolutely.
You don't necessarily, it's not like, again, I'm assuming you don't go into your office and, you have to get all of these things. You can even start slow.
Absolutely. And I always start when someone will come and ask, and they say, I want your opinion. What should I do?
Yeah.
I will always say, you don't have to do anything. I mean, when it comes to aesthetics, right? That's a normal, intimate area. I don't see anything wrong with that. Now, if you will tell me what bothers you.
But I think that question is it's your opinion. Like, they want your opinion because, again, I think you have to be quite attuned to something that you don't like.
Yes.
So if you aren't really sure, but you want to enhance something, I think that's where your opinion is.
Yes, but first you will have to tell me what you don't like. Right?
Yeah.
I will not tell you I don't like this or that, because that might be absolutely fine with you. Yeah. And really you don't have to change it in that case.
I know what you mean.
But if you tell me, if you go, okay, I will give you an example. I had a rhinoplasty a few years back. Many years back, 20 years back.
That's amazing.
Okay. So still not perfect, but much, much better than it was. Okay. So, I went and I said, look, I have this nose and I want to change this nose, right? And I wanted his opinion of as what we can do about the nose. So it was not his job to tell me, you have this nose, but you have also scars on the face. And whatever, your eyelid is too low. And let's do also something for the scar. That's not nice. No. That's not ethical and it's not nice.
Absolutely.
And I never do that to my patients. It's, if I feel okay with my scars on my face, you don't have to tell me anything about the scars. You have to tell me only about my nose,
Yes.
Exactly.
So what's bothering?
Exactly. So that's why, I really keep it very strict to whatever, you want to enhance, what you want to change so that you feel happier.
I think one of the big ones, I have to say, that I'm pretty sure you get a lot of women coming to consult with you specifically about pain during intercourse.
Yes.
Especially after childbirth.
Yes.
Why does that happen? That's number one. And what are treatments that are available to women?
Yes.
Because that's not a way to live.
Yeah.
Especially, and I find a lot of the times you have a baby and your life goes through a transition. But also at the same time, your relationship takes a hit as well.
Mm.
And that aspect of life, you cannot ignore it.
Mm.
You're married and you're wanting to have a family, and intimacy is a huge part of it.
Of course.
So to be uncomfortable or to always kind of push it back because you don't want to, be intimate with your partner because of pain, I find that is the part that needs to be addressed more than anything else.
Yes. True.
So why do women suffer this much?
So look,
and again, it's in silence.
Yes. They take it as something, that can happen after delivery, and they will live with that. And truth is that many times, if you don't address it as a doctor, they will not come and ask for help. Maybe to me, they will come because it's a very specialized, let's say, clinic. But in general, you go to your gynecologist, you will not talk about it. Because maybe you don't know that there are things that you can do. So now why it's happening? It's happening again because the time of the pregnancy and the delivery, it's a stress time for our pelvis. So many things will be pressed. Okay. Imagine, all this weight, the whole baby will press everything there. And then maybe damages might happen. And also during the delivery, you have a whole baby coming out of your vagina. During that time, maybe some nerves will be injured. Maybe the vaginal skin, not maybe, for sure it's injured. And then the healing that happens, the recovery that happens afterwards, maybe it's not enough for you. You don't recover as you should. And that causes then the pain. I can't tell you exactly, which nerve, which exactly part of the vagina will be affected, but this is what it's happening, right?
It shouldn't be painful.
Exactly. And once you have the painful intercourse, then you associate the intercourse also with pain. And every time you're about to become intimate with your husband, you might think about the pain, and that will make you, feel more tight and have this anxiety, tense, and that then might cause contractions on your muscles at the pelvic floor, and then the penetration becomes difficult. So yes, these are the things that, by the way, can happen even before pregnancy. There are women, they have painful intercourse also without having delivered, without having been pregnant. And that just a dysfunction of the vagina or a dysfunction of the muscles. And this is where functional gynecology can help.
You mean that's before the pregnancy?
Also before the pregnancy, also before the pregnancy, not without having any stress factor, without having any trigger, a reason why this will happen. Still the problem might be there. Okay, still, for some reason, the vaginal skin might be dysfunctional.
And that's vaginismus.
Vaginismus is the tight muscles at the entrance of the vagina. Okay. We don't know why it's happening, but in some women, at any stage of your life, it can start. It can start even secondary. So you had a normal sexual life, and at some point you start having this issue, the tight muscles at the entrance of the vagina, which makes then the penetration and the whole intercourse very painful or impossible. There are women that they had a very normal sexual life. They have their children, they deliver, and then we don't know if it is because of the delivery or just, it just came. They are not able to have intercourse. It's not that they will have painful intercourse. They don't have intercourse at all because they can't. So, yeah, but again, all these things, and they can be treated. And the good thing is that among all sexual dysfunctions, and there are many sexual dysfunctions, vaginismus is one that can be treated with very high rate of success.
It's amazing.
Yes.
That's amazing because that could be something, again, give people back a second chance to live.
100%, 100%. Second chance, or give them the chance, because many women, 70% of women worldwide suffer from vaginismus. And this is only the number that we know. This
70%.
17.
Oh, 17.
So 1 7. Yes. No. Thank God it's not 7. But still 17, it's too much, isn't it? And this is a number that we know. Imagine how many women they suffer and they don't talk and we don't know.
Well, that's it. My next question is, why do you think so many women suffer in silence?
That's, I think, one thing is a cultural thing.
Yeah.
They feel shame to talk about it. Other thing is that they might feel hopeless because they might think that there is no treatment for that anyway. So even if I talk for that, there is nothing I can do about it. I think those are the two. So there is no awareness.
There's no awareness.
There is no awareness.
That's the thing. I mean, whether it's vaginismus or painful intercourse, these are topics that, you're right. It's just the fact that there isn't a lot of people talking about it.
Yeah.
And, it really does need to be almost normalized, because, I mean, we were laughing the other day, but if this was a men's issue, we would be redirecting,
of course,
government funding to try to solve it.
Yes, true.
This is not something that people need to grin and bear.
Yeah, definitely.
So what would be potential treatment options? Whether it is a little bit, I mean, are they quite similar for vaginismus and just...
So look, vaginismus is again mainly the issue is mainly the muscle, the tight muscle. So for that, if you see it very cold and just you see the pathophysiology, what do you have there? You have tight muscles. What you need to do? You need to relax the muscles, and for that you do Botox. Okay, you do Botox and you relax the muscles. You don't paralyze the muscles because you need these muscles. You can't give that much Botox. You will have other problems. But you can make them softer, let's say, more loose. Okay. So that's one part of the treatment of vaginismus, or of women that have difficulty during penetration, or they have in general they become tight when they are about to get intimate. However, it's not Botox. It's not enough. It's not the treatment. The treatment is a dilation that you do afterwards. So you do the Botox, you get the muscles softer, yes, and then you start and you do guided dilation. Guided dilation means that you are with the patient together and you guide the patient, you support the patient. It's like, imagine it like, you go to your psychotherapist and you talk with the psychotherapist. You need the support, right? You need the guidance. So exactly the same. I don't do anything as a doctor. I'm just there. I'm just at the beginning. I will say how to do it. But they refer to me. They come every 2 weeks and we do together the dilation. They do it every day at home alone.
The dilation, how?
Yeah, the dilation happens with dilators. So you
dilators.
Have dilators, right? Yeah. So you have graded dilators.
Okay.
You start with a small and then you go more and more. But this is a process which needs support, emotional support, mental support, empowerment. I believe in every woman that comes with the biggest problem, right? I believe that the moment, if she made it and she came to me and she asked for help, then and see if she wants to solve the problem, then there is no way that she will not do it. And I pass it to the woman. My belief, I pass it to them. And, we're together a team. It's like I'm the coach, and, she is
the ultimate female coach.
Yeah. So I feel myself like that. She is the athlete. She is the professional. She goes for the gold medal and I'm there to push and, she does everything. I don't do anything. But you need this relationship if you really want to treat vaginismus. Otherwise, just do the Botox and say, okay, and now take the dilators, go home and do the dilation.
It's not.
No. Because vaginismus and all these things, they are They have a lot of mental component. It's not only one thing.
So vaginismus is one. So let's say it's okay. I think I want to, because I'm a bit confused. So vaginismus is one thing.
Yes.
And then aside from vaginismus, do people just generally always have, not always, but they have painful intercourse without it being vaginismus?
100%. Yeah.
Okay.
Yeah. And this is then the muscles are fine, no problem during the penetration, but inside the vagina, when they are having the intercourse, they feel whatever. They feel burning, they feel pain, there's something poking, discomfort. So in that case, we work more with the other treatments, with laser, with PRP, with exosomes, with radio frequency works amazingly for the painful intercourse. So what we do there is, the idea is that if you get a healthy vaginal skin, then the pain will subside, and this is what it happens. PRP works also on the level of the nerves inside. So that's why it restores sensitivity. That's why it takes the pain and gives the good sensitivity. Some women will do it, they will do PRP only for sexual enhancement. They don't have pain. They just want to feel more during intercourse. So we have the so-called O shot.
I've read about this.
Exactly. So O shot, O stands for orgasm. Some women, they might not have a good orgasm, or they might not have orgasm at all. So in an effort to enhance that or support and treat that, you do the O shot, which is PRP injections in the vagina. And if you want, you can have it also in the clitoris, the injection, for better blood flow in the clitoris and better orgasm. This is a way Cialis or Viagra works, right?
Absolutely.
They increase the blood flow. So you can do it in women with the O shot. So yes, for the painful, again, we do things to rejuvenate, to, let's say, replace the old non-functional vaginal mucosa, vaginal skin, let's say, with a functional one. Yeah.
It's unbelievable. Honestly, it's literally the amount of things that you can do. Never did I ever think that.
Yes.
I mean, I kind of associated, I guess, aesthetic gynecology with almost like just a one-stop shop. Not that you've got a lot of options or a lot of treatments, and it's quite tailored. I find, it's tailored to what that person
100%
is sort of their complaints.
Yes.
Amazing.
You can come in for many different reasons, and you can have many different problems that they can be treated at the same time. Definitely. Yes.
What do you think is, sort of the future for aesthetic and functional gynecology? I feel like it's going to take over the world. Is it fairly new? I mean,
it is new. Let's say it's not older than 20 years. Okay.
That's very new.
Yes. It's not because we have the support of the technology, and the regenerative medicine.
But it's also it's also doctors like you, at the end of the day, to be able to sit and listen to women's concern in a topic or in a part of their lives that they never really spoke about.
Yes.
That's in itself something else.
Yeah.
So I don't know. It's just, I mean, you're just doing incredible work.
It's very rewarding. This is what I can say. It's so rewarding. It's the same reward, the same feeling you get when you deliver a baby, when you bring a new life, and you have it in your hand. It's so rewarding. And it's the same thing when you see happy patients, happy women after having done things, and they say, I enjoy my life, and that comes, I need to address that as well. It's not only about the topical things that we are doing. When we're talking about functional gynecology, it's also optimizing women's health and women's well-being.
Mm-hmm.
So, and we do that with hormones, with supplements. So it's also that you feel well.
Mm-hmm.
For example, many women will have the issue with the libido. They will say, I don't feel like, my sex drive is very low.
Well, so that's a huge one. When it, especially, honestly, I think especially after you become parents,
Yes.
like, there is a dip.
Yes,
100%.
Yes, definitely.
And I feel a lot of the times that's something almost expected. Oh, you're tired and the kids and your mind is always, with your baby and things like that. But it might be also a little bit of support that you would need.
Yeah, definitely. There are things that we can do and support. But when we are talking about new moms or, moms with babies or a new life, that's very, very challenging. That's very overwhelming. And I say to my patients many times, they will come, let's say, a few weeks after delivery or even a few months after delivery. And they will say, my sexual life, it's not as it was. That's okay. First of all, we have also to accept the fact that life is changing and we need time to adapt. Okay. We can't be very, rough and hard with ourselves. We cannot expect us to be the superwomen. We're not superwomen. Come on, you're a new mother. First of all, nature, will, drop your, sex drive. You will have more oxytocin. You will have when you're breastfeeding. That all drops your sex drive. You don't want to. It's the nature because the priority is something else. But if this is something that continues for longer time, and you don't come back to your normal or whatever the new normal, whatever makes you happy and you feel unhappy with that, then definitely there are things that we can do.
And I think especially because there's a point where you want to have that intimacy with your husband.
Yes.
But then sometimes there is no drive and sometimes that it might be painful and it's just, there's so many barriers to it.
Yes.
And that could really put a massive mental load.
Yes.
On a woman trying to, this whole idea of superwoman should be thrown out the window, but at least just to keep that part of her relationship quite, healthy while being a mom, while working, while doing all these things.
Yes.
So if there are supportive treatments and if there are options that can potentially get you to a point where you are comfortable, specifically when it comes to whether it's your intimate life, whether it's your functional, whatever is going on. Learn about them.
Exactly.
Consult with Dr. Maria. There are options. You don't need to grin and bear it just because you became a parent or you're perimenopausal or if you're menopausal.
Yes.
Or even if you were, in your 20s.
Yes.
Like I said, you said things like Viagra, Cialis. These are all things that have been around for decades. But when it comes to women, it's all quite, it's talked amongst, in small women's circles and it's spoken about quite hush hush and it shouldn't be the way.
Yeah. Plus, women sometimes, which is sad, we shouldn't be like this. They might say, it's okay for me. I will pretend, Yes, it's okay. It's, for men, it's more difficult. We have to give them that, right? In that, they have more challenge. So, but you see.
Acceptance.
Yes.
That's what it is. It's the acceptance that, it's all right.
It's all right. Yes. No, it's not. Yes,
it's not
exactly.
all right. And that's not what, again, if I had daughters, I have boys. So if I had daughters, that would be the first thing. It's not all right. Don't settle.
Yes.
We say this to our boys and girls as they're growing up. Do not settle.
Yeah.
And you don't need to settle in your professional life, in your parent life, in your intimate life. Don't settle. Reach for the stars and live your life. It's short. Why would you suffer in silence?
Yes.
Oh, this was just honestly the most enlightening conversation.
Oh, thank you so much. It's the goal of my life.
I can see that. I can see that. And honestly, it's the fact that it really is the most wonderful form of female empowerment because you're giving choices. You're giving women an ability to feel better or change something that they're not really that happy with. And it is a quite an intimate decision because it's in an intimate area, but also at the same time, it's going to open wonderful new doors for them. I find, you know, whether it's confidence, whether it's comfort, whether it's just, I'm in awe.
Thank you so much for letting me talk about it because you know that's
also get so many questions. And then what? And what about this?
Yeah, it's you know, it's not easy to talk about.
No.
It's not easy to find people to be willing to talk about it. You know, and my goal now is the awareness. You know, at least once in your life you have heard about it.
Absolutely.
And if you get into the position that you need to ask or treat or whatever, there is something there, you know. We are not hopeless. There are so many things we can do.
What's your vision? Are we going to take functional and aesthetic gynecology sky high?
That's my absolute.
I think you are single-handedly doing that here, though.
There are some doctors, you know, good thing is that it becomes more and more popular. Maybe not that, let's say, organized in one place, everything and so on, but you see that doctors, at least, they become aware, you know, and either they will refer patients or, they will do training themselves and so on. There is something moving. Absolutely. And that's so positive. That's so nice.
And it's, you know, again, for the critics who are constantly, oh no, it's a luxury. But down the line,
yes,
that luxury is going to be a necessity when you are having to do potential surgeries for incontinence or surgeries for I don't know what. So be preventative.
Exactly.
It's not a luxury.
Exactly.
Have a baby or, I mean, even before pregnancy, get this done.
Yeah.
Look after it as you wash your face.
Exactly. Think about this area as part of your life, which has, your life and your body, which has needs as well as every other part of our body.
Yeah. I'm going to make an appointment. I'm going to come and see you.
Anytime.
I will. Because to be honest, it's not something I ever think about. And it's a shame. And this has changed everything.
I'm very happy. I'm very happy.
Thank you so much.
Thank you very, very much. Very honestly.
I cannot explain to you how incredible this was. And the amount of information. And I know that this is going to be so helpful for so many women. So I cannot thank you enough for coming here and talking so openly and quite supportive and making it very non-intimidating. So I'm really,
it is not at all intimidating. No. Never, right?
No.
Thank you for giving me the opportunity. I really mean it.
We need to bring you back. I want to talk about perimenopause, menopause, and specifically vaginismus.
Yes.
So that's it, guys. It's a series. Thank you, Dr. Maria.
Thank you very much.
Thank you for listening to They Say It Takes a Village. I hope you enjoyed today's episode. I look forward to bringing you another one next week. Don't forget, please subscribe, rate, and review so I can reach and help even more parents. And if you've got a topic that you'd like me to cover, please head over to my Instagram page, ittakesavillage.me, and drop me a line.